Hello, I'm Maureen Welch with Navigating Disability Colorado, and today we're here with Abby from Abby Care. And Abby Care is a home health agency that works with families like ours who are family CNAs. So I'm excited to meet her and have her speak about the company today. So why don't you tell us a little bit about Abby Care?
Thank you so much for having us on, Maureen. And again, yes, my name is Abby. I am not the Abby of Abby Care, but my job is really being a community liaison, working with our families, and then working with partners to share resources like this. So as you mentioned, Abby Care is a family CNA, family caregiver program. So we primarily work with pediatrics 21 and under and their caregivers. So it's a completely free program through Medicaid or the waivers, which is why your services are especially important. And then we just help caregivers get compensated for the work they're already doing and then really provide community and other supports so that, it's not just a paycheck and they're kind of left. So it's a really valuable work because we always tell families, if you're not doing it, you'd have to be paying somebody else to do it, and your child or your loved one best. So
Right, and all the research shows that family caregivers have better health outcomes.
Yes.
So it's actually a better investment for our country and our state to do.
Yes.
So can you tell us a little bit about the history of Abby Care? We see Abby Care all over social media now, and it's great. We love it. And it just seems to be very different than the other agencies. Can you tell us about the history?
Yeah, definitely. So Abby Care is fairly new, as people know, like a few years old. Our founder really has roots with this community. So she actually was a caregiver for her sister and really has experience navigating Medicaid, especially with parents that were immigrants and language barriers, which can be really tough. So I feel like that's where our passion for family-based care comes from. So as you mentioned, some of the things that are a little bit different, that's where our community is huge, and it's super important because while the paycheck and having a nurse who understands your child is so amazing, it's also not going to solve all of your problems, and we don't want to pretend like it will and leave families behind. So that's where the idea of connecting families both in person and virtually and providing them with the resources they need really comes from. So our founder and owner, she's just super passionate about that, and we promote a lot within where our office manager, a lot of our instructors actually are family CNAs or we're in our program. So I feel like that really just promotes the growth and the advocacy in the community that we strive for.
Wonderful. Well, I know one of the common questions that comes to Navigating Disability Colorado is how can I, as a family member, be paid to give care to my loved one? And we know that the ways to become eligible for a CNA program is if you're on Medicaid and you qualify for long-term care, or a lot of people call it disability determination. And you can do that just because of being low income. And then if you are over income, the other option is to get on a waiver. And then that waiver basically looks at that individual on the Medicaid program as an individual household. So they don't look at your whole household income. They just look at that one person. So for example, my son who's 17 doesn't have a job. So his income is zero. So he would qualify for Medicaid. You do have to make sure the assets are under $2,000 cash assets. And that's basically the way that they evaluate financial eligibility. So when a person is on the state plan, or as we call needs-based Medicaid, they can access you. Do you have families that are on the state plan that maybe might qualify for the waiver?
Honestly, that's something we're working through. We're trying to have all of our families at least apply for the waiver. We might have a few, especially as you know best. There are different waivers with different qualifications. So we do have a good number that are not on one. I probably can't speak to whether or not they'd qualify for which one. Right. But that's something we're really pushing, especially if our families, if their loved one is going to need services as an adult. Yes. And so that we can, hopefully get them on that CES waiver and then transition, which is huge, as you know. And then something else we've been working a lot with is like the CHIRP waiver. So we work with some great organizations who do like high needs, like placements for like foster or kinship care. And so that's really a gap we're trying to fill.
Wonderful, wonderful. Well, providing care in the home is one way to earn income, but it's also a way through Abby Care to create community. So the one thing we see is you have a lot of events in the community. And I think one thing that we know as a family caregiver myself is it's isolating.
Yeah.
When you take care of your loved one and you're giving, having that community. Can you give us some examples of events that you've hosted recently?
Definitely. Yes. So we actually did one last night that was one of my favorites. It was like a mom's night out event. This one was specifically for moms who have children with autism, but we do variety of different events for different
Seems like you do one every week.
Yeah, basically we do. We did also a low sensory children's museum event this week as well. But the one last night was just a chance for people to come together. We had wine, food, and then we had Wonder Stems, which actually one of our moms created this business called Wonder Stems that focuses on inclusive and neurodiverse friendly floral shops. So she employs and does internships for different individuals with intellectual or developmental disabilities. And she also goes into day programs and does caregiver stuff. So she's amazing.
Look her up.
Yes, definitely. I will give you
Now,
her
did you
info.
host something at Brewability where you made bouquets or flower arrangements? Was that also?
Yep, that was also with her. And so
Because we had Brewability on one of our video too, so wanted to give them a name drop.
Brewability is great. It was so fun. And I feel like, too, a lot of our moms hadn't been there before. And we even had some that were like, people always tell us we need to do self-care, but what do I do? So she was like, so I feel like it's great to have those organized events where, you're doing the bouquet making, it's relaxing, you get pizza, you get a beer, and you get to just engage and you don't have to worry, is it a safe space? Is it accessible? Are people going to judge me or my family? And that's really the goal is we'll take all of that off your plate so you can just come as you are, you can enjoy it, and you're understood. And as you said, it can be really isolating.
Yeah. So one thing that we talked about was navigating disability, offering those courses for waivers. And I do know a lot of people get on the waivers and they try to figure them out the first year. And then they say, well, maybe I want to look into becoming a CNA.
Yeah.
What's the process when they call up AbbeyCare?
Yeah.
How do you guide them through that process to see if they do qualify?
Yes, so it's a very simple process. We try and make it as accessible as possible. So the intake is very short. It gives us a background on, you and the person you're caring for and what diagnoses they may have and some background for our nurses. We work with you to gather documentation as well from different therapy providers. Maybe you're on an IEP or your child is. And then once you do that, we use what's called the pediatric assessment tool. So we typically do it virtually to make it accessible for our families. And actually some of our nurses who do that also have children with different diagnoses. So they really understand the family who's on the other side. And we just go through for about an hour per child of what does daily life look like? What does your worst day look like? Anything from eating, bathing, mobility, or dressing. And that with the documentation will tell us how many hours a day you can be qualified to pay. So after that, if you have Medicaid or you have a waiver, you can start right away. I think our fastest time from someone calling in, wondering about CNA to going to their welcome kickoff was 18 hours. So they were ready to go. So
how hard is the program in the school to get certified?
Yeah. As you know, being a CNA, it is work and you do have to focus. That being said, we try and provide a lot of one-on-one support. So most of the course is virtual. There are 4 days in person, 2 days of labs, 2 days of clinicals. We're very conscious to make sure we're doing those on days that work for you, helping with transportation or childcare.
And are the rest of the lessons online?
Yeah.
Because back when I got my CNA, it was all in person. It was before COVID.
Yes,
so.
and I bet that's so hard because so many people coordinating.
You have to get care.
Yes, and coordinating care. And we work with so many families where that's not really an option or, cost was a barrier. So we'd really try and eliminate that. We give families the tablet, a scrubs. We give them even a skills kit so they can practice at home. Okay. And so most of it is virtual. And then you have your written exam and your skills exam. So you have 3 attempts on both. I would say we have a pretty good success rate of first time passing. And that's because, as I said, a lot of our instructors, they were there. They were parent CNAs. They know how to relate it to your child and not just.
And are you, you offer your own training, which is unique.
Yes.
I don't believe there's any other agency in Colorado doing that now. Why do you do that? And what are the differences between that training and other people?
Definitely. We offered it just to make it more accessible. When AbbeyCare first started, we were working on training, but we were partnering with other community CNA organizations, and we just weren't seeing the success rate that we believed our families could obtain. And that's because that empowerment piece was kind of missing. As you said, it was either in person or, families felt uncomfortable because there was no one else that were family CNAs there. And the trainings were just, yes, they were lacking community and they were lacking people who understood. And so we really created ours to be accessible so that if you can work on it at the library or a waiting room while your child's in occupational therapy, you can do it then. And we actually offer like practice tests and videos so that it's not just, okay, complete all the training and hope you remember it. There's steps along the way. And we really have insight into what families struggle with.
And I understand how offer that in Spanish as well.
Yes, yep. So we actually created like the first Spanish CNA training.
But the actual test is only in English, correct?
Yeah, so the written exam they can take written or orally in Spanish. And then right now the skills exam is just in English. We're trying to do a lot of advocacy to change that because especially if you have one test in Spanish, that doesn't really make sense. But we still have a pretty high success rate with our families passing it in English.
Wonderful. And what would you say when you see a family call and ask to get on the CNA and then pass the test and then get services? What's that transformation like for a family? Can you maybe think of a story or two?
Oh my gosh. There is one family that really, touches my heart. And, families have so much going on behind the scenes. And that's another reason a typical program doesn't always work. So we had this one family where they were actually living in a bus and the child was on the spectrum. They were trying to coordinate services, get him into therapy. There was just a lot going on. There's often like food or housing insecurity. And so we were able to help get the child into ABA, PT, OT speech. He now has some working language, which is amazing. But more importantly, the family now was able to get an apartment. And the parent who went through the program, not only are they being paid to care for their child, he's actually started caring for other people as well. So it's really allowed him to be able to provide for his family, give a stable environment for his child. And I feel like even the transformation of the personality, when he came in, he was very nervous, anxious, wasn't really participating a lot, and now comes into the office all the time, connects with parents, is really just a light. So I think that is kind of my sweet spot is just when you give someone a chance and you empower them and support them, like look what it does not only for them, but for that child as well.
Well, the other thing that I talk a lot about at Navigating Disability Colorado is how we often give up our career path as a parent because of the complexity of care, or if they have to leave school a lot because they're sick, then generally keeping your own outside of the home employment is hard. So personally myself, it was very nice to get a paycheck after I hadn't been compensated. And I think that just like any of us that get our first job, getting that first paycheck is a big milestone. And it also gives value. Not that I didn't think it was valuable before, but it's nice to have a little extra pocket money for things. And having given up my job teaching, it was nice to have some income that I could call my own.
Exactly. And I feel like it's validating, as you said, because a lot of our families have had comments made to them like, you're just a stay-at-home mom, or you're just this. And they're like, no, I'm a CNA. I'm bringing in a paycheck. Like you said, many people have had to, leave their careers and to care for their family, and you shouldn't have to choose between one or the other. So I feel like it's just really, again, like empowering and important. So
wonderful. Well, I've learned a lot today. I do want to encourage people that are on a waiver or the state plan because they qualified through income to consider looking at a CNA. Yeah. And even if you call up a home health agency, including AbiCare, and find out that maybe you don't qualify for as many hours, you should still do it. Yeah. You may be surprised. I was surprised that my son got 3.5 hours. Yeah. And it was something that I hadn't really considered till someone suggested it to me. So now I'm suggesting it to you, and so is Abby, that you call and you fill out that PAT, pediatric assessment tool, over the phone and see. And there are some other ways to earn income. For example, on the CES and the CHIRP waiver, a family member can earn income by providing care for Community Connector and for Homemaker. And then if you're on the SLS, you can make income for being a provider of someone 18 or older. And then if you're on the DD waiver, parents can also make income as a family caregiver through the IHSS benefit. So I think that the CES has a lot to offer, but even if people can't get on the CES, you should look at the CNA program. So I really appreciate you coming out today and sharing about AbbeyCare, and I look forward always to watching those videos. So, keep them up. Tell your social media person they're doing a good job.
I will. They are great, and thank you for having us and just for all of your insight. It really is so important because I feel like a lot of stuff isn't shared with families and people don't even know, what are waivers, how to get on them, or even once they're on them, what they can access. So just having someone to guide them through it that's also been through it is just so amazing.
Yeah, it's similar to your founder where they realized that there was a need that you needed to fill, and sometimes you have to do it yourself when no one else is doing it.
Exactly, and just do things a little different, as you said, and make sure that it's really a wraparound support. So it's amazing.
Wonderful.